Electronic health records, or EHRs, are a collection of health recordings storing patient data that can be shared across various healthcare settings. EHRs are excellent for doctors to view patient information and relevant information. However, the data present may be vastly different depending on the service and the user role. Administrators, for example, could obtain billing data while a nurse can report adverse reactions. However, each EHR is not well integrated with other EHR systems. Each vendor typically uses its own vocabulary and user patient identification systems. Therefore, a clinical user would have to open a host of applications and log in to find relevant patient information. Having this disparate data makes it difficult for it to be aggregated and integrated into displays like flowcharts down the line. So in order to fix this issue, an integrated vocabulary architecture can be constructed in order to improve sharing data amongst various systems.
So based on the article of application of electronic health record in healthcare, I am going to discuss about the problem with long-term preservation and storage of records. So the article states that the biggest concern with storing and using patient electronic health record is privacy, because the records of the patient might be used and viewed by many independent sites such as physicians, hospital, and even insurance companies. So the records are most likely going to be stored for a lifetime that can be accessed by these independent sites anytime. That is why the electronic health records conflict with accessibility and privacy of the patient information. And from my personal point of view, health information always goes in hand with privacy issue. For an example, I wrote about developing a technology that will monitor the patient opioid prescription intake for the hackathon project. And the biggest concern for the technology development and implementation is once again the patient privacy. So any healthcare technology product, record, and policy always need to consider the possible conflict with patient rights and privacy. Thus, it is important to consider the privacy and accessibility aspect of the electronic health record.
Hello, my name is Jamila Bugazi, and I will be talking about the components of an electronic health record system. So, electronic health records uh, systems usually combine data from different sources all in one place, and this is used to assess patients. So, the number of components tends to vary, but generally there would be an administrative component, which is an important component, where patient's registration, their admission, their discharge, and their transfer information is in one place. Usually there's a laboratory system component, and this is where lab results, orders, and billings are shown. There's usually a radiology system component, which is where um, one can track and schedule and find the reportings from results and image tracking. There's also a pharmacy system component. There's also a physician order entry component, which is where providers can um, electronically order lab, pharmacy, or radiology services. There's clinical documentation component, which is where clinical notes, patient assessments, and clinical reports are taken. And this is usually where the physician would type up notes when they see you during an appointment, for example. And I personally think that EHRs are very useful because all of the patient information is readily available to all healthcare providers. So tests do not have to be unnecessarily repeated or done, and results and data could be shared.
Hello, I'm going to be discussing the summary and my personal opinion of Article 2. Computerized physician order entry systems are programs that doctors use in order to send out computerized prescriptions to their patients and pharmacies. Ideally, this is designed to help limit medical errors. Sadly, the truth of the matter is that CPOE systems fail to send alerts for 39% of harmful drug orders, according to Leapfrog Hospital Survey Report Series of 2015. Along with this, the systems miss 13% of fatal medication orders. Overall, CPOE systems have slowly and gradually improved in accuracy, but there needs to be a steeper rate of improvement in order to protect more patients from medical error. To the annoyance of physicians, Leapfrog suggests that hospitals need to be required to double and triple check their orders. Oftentimes, physicians experience alert fatigue, causing them to ignore warnings. Also, oftentimes, hospitals do not add new treatments or guidelines to their systems, causing potential error in the software. Overall, the report states that 96% of the country's hospitals meet Leapfrog's requirements for the CPOE software usage. Personally, I believe it is important to triple check any prescription written in order to account for errors and to keep the CPOE systems up to date and with the latest treatments and guidelines. This may cause alert fatigue to the physician, but overall it helps saves patient lives and decrease medical error. Thank you.
Computerized Physician Orders Entry System, or CPOE, are personalized programs that are developed for doctors to use to send out electronic prescriptions. The main notion is to reduce the amount of medical errors and mistakes in prescription drugs. While there were errors and harmful errors in the system to send alerts of drug orders, the program started to show an incline of improvement rate. Majority of hospitals now, and healthcare sectors and organizations, saw a decline of error typically after the second or third year of implementing the CPOE. The implementation of the CPOE is to describe the needs process of computerized physician order and entry and a method to make medications and prescription more regular and accurate by minimizing overdosing or incorrect prescription. I personally think that it is important to update any prescription order and account for errors to lower the margin of mistakes in the CPOE system. Taking an example from my hackathon paper, I discussed the ideas of providing live data feedback between patients to doctors in order to give more accurate feedbacks and a personalized experience, which I think parallels to the implementation of CPOE in saving patients' lives and decrease medical errors.